Our second speaker is Dr. Diana Ramos, and she is the president of the Orange County Medical Association and the incoming chair for the California American College of Obstetrics and Gynecology. Dr. Ramos is a well-recognized public health expert, a board-certified obstetrician gynecologist, and an adjunct assistant clinical professor at the Keck University of Southern California School of Medicine. She serves as the vice chair of the California American College of Obstetrics and Gynecology Executive Committee and other women's health committees, providing leadership and guidance to obstetricians and gynecologists throughout California and the U.S. Her areas of expertise include health disparities, preconception, interconception health, contraception, and quality improvement. Nationally, she is on the American Medical Association Healthcare Disparities Advisory Board, co-chair for the March of Dimes Health Equity Advisory Group, and on the board of the National Hispanic Medical Association. She has written and contributed numerous articles to the obstetrics and gynecology and public health literature, and has received numerous awards for her work. Dr. Ramos received her medical degree from the University of Southern California with honors and completed her residency training in obstetrics and gynecology at the Los Angeles County University of Southern California Medical Center. She obtained her master's degree in public health with an emphasis in management from the University of California, Los Angeles, and received her BA in Communications, Arts and Sciences from the University of Southern California.
Thank you very much for the opportunity to present with my esteemed colleagues. And I am going to be presenting on how perinatal mental health has impacted us in the times of COVID. I know we've heard some presentations from Dr. Chu, and we've now heard some more information, more importantly, on the caregiver aspect of things. And it's really important that we focus on the caregiver. Oftentimes we find that that's the second person that is impacted and affected. So if I can get the next slide. So I'd like to start out with a case, and we can, I think, all associate knowing somebody. If maybe it's one of our patients, one of our relatives, but this patient is a 31-year-old Hispanic female. She's pregnant with her second child. She is married, is 34 weeks pregnant, and she has a history of postpartum depression. She has a 4-year-old son, and her normal job is a manager at a hotel, but now with the shelter in place, she is starting to feel stressed. She probably is having telephone prenatal care, phone encounters, because as you know, the visits during pregnancy have been limited to try and decrease the exposure to any asymptomatic COVID carriers. So what is it that we can be expecting? Well, not only is her risk for depression higher because of the fact that she had postpartum depression, but more importantly, now with the sheltering in place, we've heard that it increases just in and of itself the risk for depression. We know that stress can become toxic, and living in an environment where we had to be sheltered in place, where our homes now became the daycare, it became the school, became our place of work, and maybe in her case, she was furloughed, the stress is even greater. And we've heard the increased risk for domestic violence and for child abuse. So really, this is an opportunity for us to stop and think, what else is happening? And when encounters are being done over the phone, to really maybe spend an extra 5 or 6 minutes asking what are the social determinants of health that perhaps are impacting her health even more. We know that chronic stress after 6 weeks can start to manifest symptoms of depression. So our shelter in place was over 3 months. You know, we were going on 12 weeks, or past 12 weeks. So after 6 weeks, you have an increase in symptoms. Now you can start to imagine, and we've heard the data and the statistics, why so many patients are exhibiting more signs of depression. Can we go to the next slide, please? So I wanted to highlight the fact that the impact of COVID has been not only on those who have a history of perinatal mental health, perinatal depression, or just even depression in general, but it disproportionately impacts people of color, Hispanic, African Americans, and oftentimes we stop to think, well, why is it that it's Hispanic, African Americans? Well, if we stop to think about the fact that many of the employees for essential workers are of Hispanic or African American origin, they're probably the ones that are being kept working and being put in the front line to continue providing the care of their services. Or as in the case with our patient, she works at a hotel where at the peak of the shelter in place, 90% of all hotel industry was shut down. So if there is no income coming in, there's even more stress. The impact of COVID didn't cause the diseases more so in minority populations, but I think it enlightened us to the underlying high risks that are already present, that are already occurring. Meaning that maybe the health insurance, maybe there was limited prenatal care or limited preconception care. So if you had a patient that had hypertension, diabetes, some other medical complication in the time of COVID, it really may not be a way to provide the best care. And the other thing that we have to keep in mind is, yes, telehealth has been skyrocketed since the impact of COVID has come into place, but that doesn't necessarily mean that everyone has the same access. We know that, yes, there are some telephone encounters that can be done, but the other thing to remember is that not everyone has access to the internet. And this has really come to light, not only with our patients, but more importantly with some of our children when they're trying to access schools remotely. So again, just keeping in mind that women who are at risk with depression, anxiety, are at increased risk, during this time of COVID because of everything that is happening. With 1 in 5 women in Orange County and in the country being impacted with perinatal depression, with depression in general, this is something that is very real to many. Can I have the next slide, please? So I mentioned in terms of data, 1 in 5 women in California suffer from depression or anxiety and while they're pregnant or giving birth. And I want to emphasize giving birth because right now in the hospital, depending upon what facility the woman is delivering in, the partner may not be able to come into the hospital, may not be able, usually maybe there's 3, 4 people present at delivery, and now maybe there's only 1. So somebody that has a history of anxiety, she has to now labor alone. That anxiety can really increase more and trigger a lot of other mental health issues that are not going to just impact her, but are going to impact the baby, impact the rest of the family. So stressors that increase the risk for depression, we've heard, are poverty, adverse childhood events, and COVID. And again, the whole family is impacted. And you can see on the slide the symptoms of depression in California, just how it really breaks down in terms of prenatal, postpartum depression, and either both prenatal, postpartum with 1 in 5 women. So can I have the next slide, please? So again, some of the risk factors, we talked about it. Low socioeconomic status, I'll just highlight a couple of them. Unplanned or unwanted pregnancies, current stressful life events like COVID, and some adolescent parenthood. And we've already talked a lot about the financial support. And right now, lack of social support, right? There was a time when we really were shelter in place, and we've heard that there wasn't the availability for those grandparents to come visit and to come help because of the increased risk for the grandparents' health. So really, all of the support that the mom would normally have is really compounded. If you have a family that lives in a very small apartment that maybe has 4 or 5 people living in a 1-bedroom apartment, you can really start to imagine how the stress increased even more during the shelter in place. And all of that has been cumulative, and it's now starting to be manifested. Can we have the next slide, please? So racial and ethnic disparities, we talked about this. Unfortunately, there's a disproportionate higher number of symptoms of depression and anxiety among women of color, and you can see the breakdown here with a higher proportion for in the Black population and the Hispanic population. So, and you can see also the data for the Asian and the white. So nobody is immune. Unfortunately, you know, we all have that risk. There is no discrimination in terms of who can be impacted and affected by depression. It's a disease of everyone, and none of us can really escape it if we have all of those risk factors that are working against us and put us at increased risk. We have the next slide. So again, I mentioned that mental illness can impact the infant, and you can see here how anxiety disorder and major depression can impact the obstetric outcome as well as the neonatal impact on as well. So big important takeaway I would say is that the mom's health really impacts the baby's health. You can see that developmental milestones can be impacted. You have increase in the baby. Bonding can be more difficult in a mom who has anxiety or depression. And there are some increased risk for fetal growth, decreased fetal growth in women who have major depression. So really important to address and screen for depression, anxiety for moms right now when they're pregnant and postpartum. So next slide, please. So here in Orange County, the healthcare agency has come out with a fantastic algorithm on how we can actually manage somebody that we screen, and if they happen to be positive for depression or anxiety. And this is found, I have the resources at the end, but you can find this on the OC Health website, and they have a beautiful algorithm. So many times we're afraid to ask about depression, anxiety, because we don't know what to do. Well, this is your playbook to know exactly what you can do and where you can get the resources. Can I get the next slide, please? And this is a screenshot of the Edinburgh screening for depression, and know that there's also a PHQ-9. Really important to take into consideration is that the Edinburgh screening for depression actually takes into account pregnancy, because many times you'll hear the question, have you been tired? Have you been, don't have the energy to do your usual activities? Well, for a new mom, a postpartum mom, the answer is going to be yes, whether you're depressed or not. But the way that the Edinburgh is framed, it actually takes into consideration a postpartum mom. So it helps more so with the screening. So you may be asking yourself, when we heard about the caregivers, we heard about the extended circles, well, what are some considerations that we can maybe do to care for people who are loved ones, our patients, and screen for depression? Well, perhaps you can do a remote screening. You can ask the questions over the phone if the mom doesn't have the transportation, or if you're doing a visit, and you can assess what help is needed. And again, the HCA, the Orange County Healthcare Agency algorithm has the information that you can use to determine what the next steps will be after that. Can I have the next slide? So back to our patient. You know, we talked about the fact that she's at increased risk for depression, that she also the impact on her infant is going to be higher if she is depressed again, because that stress really can trigger the depression in somebody who has a history of depression. And it's great that she is married, because the partner can hopefully be supporting her. But many times, you know, we've heard about increased risk for intimate partner violence. We don't know what the situation is there. So it's really important to ask the question and to do that screening Now with some of the telehealth visits where you actually can use video, you can actually see what the home looks like of the patient. So if there is if there's a lot of disorder, chaos in the background, you can maybe start to ask, maybe there's something else that's happening, and do some further questioning. But we all have the opportunity to help our patients and our friends, our loved ones, to get through this, especially now in light of COVID, that has increased the stress so much more for everyone. And in particular, we've got 2 extra patients with the mom and the baby. Can I have the next slide, please? So treatment, many times we think that treatment is just medication. Well, treatment is actually more than medication, and this is really important to share with patients, because depending upon how the severity of their depression, it could be psychotherapy, it could be just family support. For those rare cases, there may need hospitalization, but medication may be something, as well as some self-help could be another thing. So really important. Many times patients may be borderline depressed. They may think, oh, I have to be on medication. It's that negative stigma. But we need to make them aware, look, depending upon where you are, it may determine the type of treatment that you may need. And sometimes it's a combination of everything, or maybe it's just one thing that's just going to help them get through that transition. So we need to take into consideration the cultural impact as well, that many times women, especially of certain ethnicities, see having a mental issue as something taboo that you don't talk about. And I can tell you, in the Hispanic population, that's something that oftentimes happens. We say, we don't say that you're depressed, we say that we're nervous. We're nervous, and we're just not feeling well. So we need to take that into consideration, be considerate how we're framing mental health issues. Next slide, please. And support, we've heard what we can do for the support providers, but what you can do, again, this goes back to the portion of that slide on treatment, is that really we can offer support and encouragement, help the mom feel that she's not alone. Sometimes you just need time to talk, encourage going out, going walking, ensure her that there is help, and if you see it, maybe you can help connect them to the right medical care, whether it's telemedicine or in person, and that this too shall pass, like everything else, and that you're there to support her. But as we heard before, we need to help also take care of that healthcare provider, that support person. And if I can have the next slide. So in terms of knowing what we need to be doing for COVID, what should we be doing in terms of behaviors to ensure our safety, and as we get back into society, as we start to open up? Well, my son actually developed this game. It's called COVIDBlasts.com. He saw me, he's 13 years old, and he saw me talking about COVID, and he came up with this game that takes into consideration the coronavirus.gov recommendations, and it's in a form of a game. So the white blood cell destroys the COVID. Check it out. And the next slide, please. And finally, I will leave you with a plug. We are actually going to be debuting a toolkit focusing on perinatal mental health. And this is done in conjunction with the Orange County Medical Association, First Five, the healthcare agency, and many other partners throughout the year that we've come together to try and address something specific for perinatal mental health. And we're going to have the presentation, the debut on June 9th, and Dr. Chow is actually going to be one of our speakers. So what I would invite you to participate and listen in, and that toolkit will be available on the Orange County Medical Association website and the First Five website. And last slide. And here is a list of resources, and I understand that all of these are going to be available afterwards. So thank you for the opportunity. Can I have the last one? Thank you for the opportunity to present to you and to share, and really to emphasize the fact that we all need to help each other stay safe and healthy, but more in particular our pregnant moms, postpartum moms, because it's such a susceptible time for depression and anxiety. Thank you.